70%. 70% of chief physicians in Germany report that economic pressure and economic burden they experience negatively impacts patient care. This surprising finding comes from a survey in Germany, which is largely a public healthcare system. Now, one can only imagine the pressure and burden of economics on doctors in private, corporate, pure fee-for-service healthcare systems. Interestingly, this German study also acknowledged economic pressures causing substantial deficits in nursing and human interaction. Imagine a patient asking a doctor, "Hey doc, is this the right diagnostic and treatment for me?" In today's scenario, sometimes doctors might find that question difficult to answer with their hands on their hearts. Doctors should never have to face such a dilemma. But it seems likely that they might very well do in some regions, especially in the situation that they find themselves in today. I even suspect that a significant proportion of doctors, especially in corporate fee-for-service facilities, might privately admit that some patients are overdiagnosed and some receive overtreatment, and generally this is because of revenue and profit motive or incentive. Also, at other times, patients must be turned away as they might not be adequately insured or cannot afford hospital charges out of pocket. Now, generally, they are transferred or referred to government facilities, especially in emerging economies, and such facilities, due to very high volumes, can sometimes compromise on the quality of care. Personally, I know many conscientious doctors who struggle with this humanitarian burden. They know that the outcomes could have been different if economics had allowed it. Let's go to the second survey result. 80% of physicians are at full capacity or are overextended. An astonishing 78% experience burnouts. Think about that. Burnout amongst doctors is a burning issue that needs urgent attention. I cannot adequately emphasize this issue and would like to dwell on this bit. And I would like to dwell a bit on this matter, given its serious implications for society. Doctors are 1.87 times more likely to commit suicide than those working in other professions. We can imagine the stressors experienced by a police officer, given the nature of their job. They are 1.54 times more likely to die by suicide as compared to 1.87 times of doctors, meaning doctors' suicide rates are 21% higher than those amongst police officers. And 4% of all deaths amongst doctors, after considering all causes, result from suicide. Now, these studies are conducted and published by NIOSH, National Institute of Occupational Safety and Health. Allow that to sink in. Pause. Think about this. Your doctor is likely to be very stressed. Remember this the next time you talk to her. Some empathy might help both of you. There is a complex interplay of multiple factors that underlie this burnout phenomenon. I'll try and outline a few. One, there's a massive asymmetry between patient load and availability of doctors, especially in emerging economies. For example, the allopathic doctor-to-population ratio in India is 1:1,404, way below the WHO norm of 1:1,000. Interestingly, 52% of all doctors in India are probably practicing in just 5 states, most of them probably in the south of India. Number 2, there is increasing awareness access and insurance coverage. Public spending in healthcare is about 2.1% of GDP for India. It is around 10% in OECD countries. This queue exacerbates the load on private hospitals where doctors are generally employed and practice. Number three, there is increasing patient activism and rampant medical legal cases. Also, current economic models are such that hospitals and doctors get paid and are incentivized to do more, not necessarily do better. There doesn't seem to be a sustainable revenue model in preventative healthcare. We are still a sick care economy. Doing more obviously means less sleep and more stress, right? And finally, I think other issues that doctors face, ranging from lack of control, inequities in the workplace, conflicting demands, conflicting priorities of stakeholders, technological disruptions, etc., all contribute to this burning phenomenon of 80% of doctors feeling overextended and an astonishing 78% experiencing burnouts. We know that aviation has strict rules that ensure the safety of pilots by mandating adequate rest and sleep time. FAA, for example, mandates that pilots must have a minimum of 10 hours of rest before beginning a flight period. And of this, there should be a minimum 8 hours of uninterrupted sleep. Additionally, pilots are required to have 30 consecutive hours of off duty in any 7 consecutive days. In India, the DGCA has further restrictions such that a pilot cannot have more than 2 night landings, down from, I think, 6 a while ago. An aircraft, we know, will not fly even if one cabin crew member is missing or for some reason delayed. Now, contrast this with what happens with our nurses and with our doctors. Right? When was the last time we inquired our treating doctor or our bedside nurse if they rested well? Did they sleep well? Did anyone bother? Our model today makes our doctors sprint the marathon, a bad strategy, a recipe for disaster. Because of the already unsustainable levels of stress and burnout that our doctors are experiencing. Doctors are not some jackrabbits on an endless supply of Red Bull.